the aspect of symptomatic, and symptomatic that cannot transmit, and could you shed some light on that?
Very well. I started off by telling you that coronaviruses are very common. Okay, and you can be having a coronavirus infection which is not COVID-19. Okay. And the tests that we have for determining people who are positive or not, unfortunately, they are not that specific to the COVID.
Yes.
Okay. That is one thing that brought so much confusion and made people want to standardize the tests.
Yes.
As much as we will try and standardize these tests, we will never completely be very specific.
Yes.
Okay?
Yes.
To COVID-19 as the virus that has infected an individual, because there will always be some cross reaction.
Okay.
So if you, like for instance, test everybody in a room that has got 100 people, you might find so many people who have been exposed to coronaviruses.
Yeah.
Okay.
Yeah.
But what is known about coronaviruses is, out of every people that it infects, let's say 100 people,
yes,
over 90% of these people who are infected will not have any symptoms at all.
Oh, okay.
In other words, you will have somebody who is carrying the virus.
Yes.
Like it's common with so many other viruses.
Yeah.
We coexist with viruses, especially in Africa.
Yes.
Okay.
Yes.
Not the same as in Europe.
Yeah.
But we coexist with so many different
viruses. Yeah.
Because viruses are part and parcel of our system. They get into our body.
Yeah.
They get into our cells, and when you are alive, the virus particles are alive. So they are not like bacteria that you can identify, isolate, and remove. A virus comes into your cells and stays by those DNA particles or RNA particles.
Yeah.
So the presence of these viruses is what we are able to detect by specialized cells, specialized tests, which you call the PCR.
Okay.
Now, I said, because of how common these viruses are and how common it is to transmit by, number one, either droplet or contact or by other means which we do not know. Remember, these are novel viruses. There might be oral fecal transmission, which we don't know. There are so many studies which are ongoing. There could be some from animals, we don't know. Studies are ongoing. But you will be found to be having COVID in your system. And it does not mean that you are sick.
Oh, interesting.
Okay.
Interesting.
Now, the people that we say are symptomatic, out of the small 10% who might be symptomatic, okay, the commonest presentation will be a fever, difficulty in breathing. That is basically just somebody who has difficulty in breathing. I think you know what that means. It could be a cough, or some sneezing, or a running nose, or red eyes, or difficulty in basically appreciating the taste. What actually you experience when you have homa.
Just a common cold.
Okay, common cold.
Yes.
So these are some of the commonest manifestations of somebody who is symptomatic. These symptoms will be there for 3 to 5 days, like the common homa, and disappear.
And they just go.
Okay.
Yeah.
So a lot of people who are symptomatic will basically recover without any intervention at all.
What would be your thoughts into ways of treatment? We've had in the US, they've been advocating for hydroxychloroquine, zinc as preventative measure, a certain dose as treatment. You go to Madagascar, they had their drug that they manufactured. Earlier, March, April, Uganda also was treating using chloroquine, the one we do for malaria. In Senegal, that's the same thing they did. What is your opinion on that? And as you dwell on that, could you also talk about herd immunity, where it comes in, and also good body immune system, like an individual's immune system? Could you talk about that a bit?
Fine. Let me start with the issue of herd immunity. I will change your approach a bit from herd immunity to the treatment.
Okay.
Now, what we know for human beings, when you get infected by a condition or a disease, your body reacts to give you antibodies against that infection. And the way we are designed for interacting with the world and infections is, you see, infections are never meant to be there to kill you. Viruses and bacteria, they infect you to live with you, but in the process you get some discomfort.
Okay.
Sometimes you die. That's why you say you are sick.
Yes.
But the initial reason why these viruses were coming to you is to find a host who can accommodate them.
Okay.
Now, in the process you get immunity. It means you have been able to now prepare your body to live with this disease without eradicating it.
Yeah.
But you are protected from getting other infections that come associated with the same. So you get infected now, you get well naturally. Okay. It means you have acquired natural immunity against further infections of the same virus.
Okay.
Now, because viruses are always trying to change themselves to make sure that they infect people, they will tweak their genetic system a bit by whichever means, so that now they're able to overcome your immune system and infect you again.
Okay.
That is why we find, like in the common cold, you might be infected this year, next year you can get a different strain, and the next year you are never fully immune.
True.
But what happens is you keep on getting milder and milder versions of the cold. So the same thing happens with this virus.
Okay.
So you get your immunity once you've been infected, but it's not lifelong.
Okay.
Or at least this is what we do not know, and people are still working on it.
Yeah.
That is why there's a clamor for a vaccine, but even that vaccine will not be permanent because the virus will keep on changing, and you'll be needing a new vaccine every year. Okay. So what we have now is you have been infected, you are immune. By natural herd immunity, it is expected that this infection will be infecting so many people in such a way that you acquire, for the coronavirus, we are looking at about 60 to 80% of the population being infected and being positive to get what's called natural herd immunity, that you coexist with the virus without any bother. Okay?
Interesting,
Because you have natural immunity and you live with it, and it just becomes a small nuisance like the common cold. Okay. Now, the people who are advocating for a vaccine is to speed up the herd immunity, because a vaccine gives you a small exposure of the virus, even if you did not have it, so that your body produces antibodies and becomes immune. Okay? So it is said when you have a massive campaign for vaccination, you achieve herd immunity faster. Okay? But the process is the same. So we have proponents of natural herd immunity and proponents of vaccination, even in populations that have not been exposed. Okay? Now,
so can I interject there?
Yes.
Assuming a certain population has high infection, that means they've been able to develop herd immunity without a vaccine. Would there be need for that geographical location to go through the vaccine process? There would be no need.
Absolutely not. And that is what has been happening in this country called Sweden. Okay? They went on a very controversial step in the world because they did not initiate any lockdowns. And they said they are going to be able to keep the borders of the countries open. They will not put any restrictions. People who will get infected will get infected. They will control them and they will treat them, the ones who are seriously requiring treatment. And life goes on. Close to home, we have our friend Magufuli in Tanzania, who took exactly the same approach, without so much fanfare, and said, we will live with this disease because we do not think people who, if you have 90% of people who are going to get infected not having any problems, why should you go ahead and try and look for these people and isolate them? Let them live within the population, let the disease go around, and we coexist with it. That's what they did. Now, the issue of treatment and vaccinations are different. People have been using hydroxychloroquine. People have been coming up with remdesivir. Chloroquine is a medication that we've had in Africa for so long.
Yeah.
In terms of treating malaria.
Yeah.
What it does, it suppresses somebody's immune reaction. Chloroquine has also been used in allergic conditions of the skin by our dermatologists.
Yeah.
Okay. And in arthritis.
Okay.
Okay. Because it suppresses the body's immune reaction. Remember, one of the complications of COVID is because of the excessive immune reaction of a person to that virus.
True.
Okay. So chloroquine has been found to reduce that excessive reaction.
Yeah.
And thereby prevent the serious complications. So it can be used as a preventive measure, or during the period when somebody has been infected who is symptomatic.
Okay. Yeah.
But not anybody who tests positive.
Okay.
Somebody testing positive does not require any treatment at all.
Oh.
Only somebody who is symptomatic.
Yeah.
Now, the amount of treatment that is going to be given also depends on the severity of the symptoms.
Yeah.
So traditionally what was happening was somebody who's having difficulties in breathing, we would give them oxygen because you want to increase the delivery of oxygen into their system so that their bodies are not starved of oxygen.
Yeah.
When the severity of breathing is so severe, then patients would be put in ICU and be delivered oxygen by a machine, that intubation.
Yes.
And this is what was happening. And you remember in the US, they were entered on the way to acquire so many ventilators.
Yes.
In anticipation of a high number of patients. The number of patients increased, but not to the extent that it was projected. In Africa, there's a country, Madagascar, that came up with a plant extract. I will not comment so much about this because it's in the area of alternative medicine. But what we know is the same things that we use in our body to prevent us from getting viral infections or getting serious conditions in our bodies are the same things that are useful in protecting against COVID infection.
True.
So, naturally, a human being requires a well-balanced diet.
Yeah.
Nutrition needs to be rich in proteins, carbohydrates, and vitamins. Among the vitamins, we have essential elements, including zinc, selenium, and other small elements which are important in our immune. Now, people decided to concentrate on zinc because zinc is a natural element found in very small quantities.
Yes.
It's also found in our natural diets.
Yeah.
Okay. Now, does the use of supplements assist somebody when they're going to get COVID? If your dietary intake of these supplements, of these chemicals is low, then you are definitely exposed.
True.
Now, many people in Africa take natural foods. Okay?
Yeah.
And you will find a lot of them actually do not have any dietary deficiencies. The people who have a lot of dietary deficiencies are people who take artificial foods, all right? Or processed foods. Foods that have been processed.
Yes.
They do not have the natural ingredients in the soil.
I get it.
But people who take natural products, green leafy vegetables, potatoes, beans, all they so natural ingredients in their bodies that they might not require. But unless you go and get tested, the safe approach is to take what is naturally accepted to improve your immunity.
Exactly.
That's why there was a clamor to take lemons, ginger, green vegetables, and lots of things. I understand they went off the shelves because people clamored for them.
Yes.
And it's in order. Okay. This is to boost your immunity, not to avoid getting COVID, but to avoid getting complications if you get infected. Because we will get infected for sure.
Anyhow.
But we do not need to worry about the side effects because we are in Africa and the immune system basically takes care of it. The people who get treated are the ones who get symptoms.
Yes.
So symptoms, I said, can be a fever. If it's uncomfortable fever, then somebody takes some paracetamol. Take the fever down. If somebody is getting difficulty in breathing, of course they need some bit of oxygen to help them.
Exactly.
If somebody is having severe complications of clots, then they need some anti-clotting medications in the hospital. So the treatment is different according to the people. Where would somebody use an antivirus? That is something which is outside there in the debate, but the idea is to kill the virus. My thoughts on antiviruses is we do not kill viruses. When we give medications to kill viruses, we are actually killing somebody's cells which contains those viruses. And that basically sometimes can cause even worse problems than living with that virus. That is basically my take on it. And it reminds me of our clamor to give antivirals to patients who are HIV positive, because we were causing more damage to the patient's cells than the virus was causing. But that is a subject which is beyond the scope of our discussion.
Yes. Thank you.